Hi everyone, my name is Cindy. I'm a medical student at the University of Melbourne, and today my oral is about future health today. This is a new quality improvement technology platform to be used in general practice, and it is used to help detect and manage chronic diseases. At the moment, we're focusing on chronic kidney disease, but in the future, this will be expanded to include other diseases such as diabetes. My project looked at exploring the implementation of Future Health Today during a pilot study, and my supervisors are Associate Professor Joanne Mansky-Nankervis and also Dr. Barbara Hunter. So digital technologies are increasingly being used in primary care, also being used for quality improvement. And we've decided to focus on chronic kidney disease because this is a very prevalent condition. It affects about 10% of the population. However, it's also a silent condition. So a lot of people don't realize they have the disease until it's too late. And so it's often under-recognized and under-treated in general practice. However, digital technologies have been shown to benefit care. So Future Health Today is a new software. It helps GPs to detect patients who may have CKD by applying algorithms to data stored in the electronic medical records. And so what does the tool look like? So FHT displays patient results in a dashboard. It also has a point of care clinical decision support tool. It provides you with access to online clinical guidelines, and it is also a quality improvement tool by providing audit and feedback functions. So my research question was, what are the barriers and facilitators to the successful implementation of Future Health Today in general practice? To set the scene a little bit, FHT was co-designed with the users, and it was piloted at 2 GP clinics last year in Victoria. So originally this year, my project was going to be conducting interviews with a couple more sites. However, these interviews were deferred, unfortunately, because of COVID. So my project focused on the pilot phase interviews from last year. And currently, FHT is undergoing an optimization study with a trial in mind in the future. In terms of the methods, the 2 clinics were situated in outer metropolitan and regional Victoria. Participants included practice managers, nurses, and GPs, and we conducted 5 semi-structured interviews and a 1-hour focus group with 6 participants. The data was analysed based on the framework analysis approach, using a theory called the Clinical Performance Feedback Intervention Theory. I'll briefly explain what the theory is. So this theory is a framework for evaluating and developing feedback interventions for healthcare professionals. For example, FHT is an example of a feedback intervention. So the theory is revolved around this feedback cycle, and you have to go through each of these steps successfully for the feedback to be successful. And there are a variety of variables that affect the cycle. So going to the results, I'll explain the barriers first and then go through the facilitators. Keeping in mind that our study was a pilot phase study, so one of the main jobs or main goals for the users were to identify issues for further development of the tool, and it's a little bit different from the clinics being end users. One of the main issues we identified were functionality issues with the software. So these included things like the visual display being initially too complex, some functions that were missing. However, all of these have been taken on board by the tech team, and the software is now undergoing major changes. There was a substantial amount of time and also staff hours and financial costs being used to troubleshoot and test out FHT, and this is where most of the costs came in. However, it also reflects the amount of time that staff spent trying to use the program for patient recalls. There was some concern with the accuracy of the EMR data, and this is not specific to our clinics, but it's also a widespread issue, so this can be further explored in the future. So what were the facilitators? One of the greatest facilitators we found was that all the participants were very engaged and enthusiastic about testing and using FHT. They held education sessions and they spent a lot of time trying to work the program. They also benefited from participating in the co-design process because it really helped them to engage with the tool much more. And lastly, almost all of the users reported that they had increased knowledge in CKD management. So what does this mean for the future? Currently, FHT is being installed at 12 different clinics and being implemented. So through this pilot phase, we've identified some suggestions. Firstly is to engage the whole clinics by installing the software in a phased approach so that everyone has access to use it. Secondly is to continue to strengthen the champions within the clinics. Thirdly is to offer some external support, for example, from the primary health network. Fourthly is to demonstrate the cost effectiveness of the tool. And lastly is to ensure that there is open communication and feedback between the users and the FHT team. And that's it from me. Thank you very much for listening. I'm happy to take any questions.